Okay, so this is a video station. Our candidate is Dr. Rukaya for today, as she's an exam going candidate. So, as you know, this is just like all the stations, and you will be having how many minutes? 2 or 3? Anybody to watch the video? I think it is
4 minutes.
4 minutes. Okay, thank you. So you'll be having 4 minutes. You can play this video as many time as you want. And after that, you will be asked about the condition that what you saw in the video. It will be like this. Then what is your diagnosis? What is your differential diagnosis? How you're going to investigate? How you're going to plan a management for this. Okay. So I'm going to play the video. Your time start. Anyone who is free, can you put a timer, please? By the way, there is a lot of time in video station. It is the only station in which you have ample of time. Okay, I myself will put the timer. Okay, your time starts now. Would you like to see again?
Yes, sir.
Okay. One time more, okay? Okay. You're fine. You're fine, or again you want to play? Still, you have time.
Yes, sir. I'm not getting anything.
Okay. Again. Sound is coming to you or not?
No, there is no sound.
Oh, that's the problem. Okay, there is no sound. Okay. That is actually an issue with these videos, that I can get a sound, but I don't know, you guys are not getting sound. That's why you're not getting anything. Okay, just wait. Again, okay. I think one time more I'll play. You're fine, or you want to see it again?
No, sir.
It's okay, one time more, no problem.
Tracking allows people.
Okay. So the first question, they'll ask you that what you see in this video. So you just have to explain that what you're seeing. So what do you think what you saw in that video?
Generalized rash, non-blanchable.
Hmm.
Mm,
You just explain
it's
what you saw.
yes, it's not raised.
Okay.
Mm, mm.
Okay. Anyone else who is exam going who want to explain the first portion what you saw?
Can I?
Okay.
I can see infant child lying in
Hmm.
a hospital setup.
Hmm.
The child is with a long line or a probable cannula seen in the video, not in distress.
Hmm.
And the child is pale in color but having macular rashes all over and also petechial rashes. And the child is not distressed.
Okay. Anything else? What you saw at the end, somebody doing.
The glass test.
Yeah, that is very important. If you missed that, so you
Non-blanchable.
missed, yeah. An examiner is performing a glass test on the rash, and this is most likely a non-blanchable rash. Okay, so this is how you have to say that what you saw. So you can say that I can see a boy, I can see a child, because you don't know this is a boy or girl. Okay, I think Dr. Asif joined. Let me, Dr. Asif, he is a good candidate. Dr. Asif, you're here. Actually, we want to repeat this again and again so that you know what to say. See, you can say that I can see a child. You have to comment on the age, because age is given to you. Whatever is given to you, you have to comment on that. So you cannot say a child, you cannot say an infant. Why? Because age is given to you. So you have to comment on the age. Everything has a marks. And remember one thing, that the video station, you can't afford to lose a single mark in that. Why? Because this is an easy station and you can get 6 out of 6. There are 6 marks for video station. So 6 and 6, 12. So you can take all the 12 marks if you comment properly on that. And why they are important? They are important because these marks, whenever you need in a long station, like for example, development, which is a difficult station, for example, you got stuck up there and you had some problem, you lose 2 3 marks, or for, God forbid, you lose a mark or two in clinical station. So these marks, the full marks of the video station, it will make up for those things. So that's why it is really important that do not miss a single mark from here. Okay, so simply say that I can see a 1 year and 8 month old child. We don't know the sex of the child because it's not shown to us. There is a generalized body rash over the body, and this rash does not seems to be in crops, so it doesn't seems to that of the measles, sorry, the chicken pox. And this rash is a sort of a macular or maculopapular most likely. And I can see that there are some bright areas, like and some uh, areas which are not too much bright. At the end, I can see an examiner who is performing a glass test, and most likely this is a um, non-blanchable rash. One other thing which you guys missed, and that is that I can see a sick child. See, once again, just watch this video. Why? Because see this, the breathing, I'm not very much satisfied with the breathing. And the second thing, a blood pressure cuff is connected to the left hand. Nobody commented on that. You have to comment on each and everything. That's why they give you a very short videos, but in that video they want to see everything. Okay, so you have to comment on the even when we were doing it with one senior colleague, he told us that even you have to comment on the pampers, even that he was naked, other than he was wearing a pamper. So these all things are relevant. Okay. Okay, so now we move forward. So Dr. Kaya, you tell me, so based upon your observation, what do you think, what is your most likely diagnosis?
My first differential will be measles,
Okay,
and then a meningococcemia.
okay,
Um, um, can be allergic rash.
right.
Mm,
Okay, so you're always remember one thing, that whenever you're taking Royal College exams, so think of meningococcemia on the top. Why
yes.
there
The
should be a
child
blood,
separately.
yeah, why there should be a blood pressure cuff connected to a child with measles? Okay, so it means that this child is sick one, and that's why there is a blood pressure cuff connected, and we know that there can be low blood pressure, a shock-like condition in meningococcemia. So better to say meningococcemia on the top. Okay, so these are very simple things, but they count at the end. Okay, so can you tell me what are the other differentials of non-blanchable rash?
Mm.
You said measles, you said meningococcemia. Is there any other example which is common in pediatric age?
Mm.
It it could be vasculitic rash.
Yes, like, yeah, HSV.
Yeah.
Yes, so you should be talking about at least these two, three things. You should not forget these two, three things.
Also, ITP is one of the DD.
Yes, yes,
ITP.
yes, ITP. Very good, very good.
Non-blanchable.
Yes, ITP is also one of, so these three, four things, they should be on I mean on your fingertips, because this is one of the most common video coming. Okay, ITP, the HSP, and this one.
Viral anthem.
Yes, viral. Yes, exactly. So these are very important. Okay, so how you are going to investigate for this child?
I will do complete blood count.
Mhm.
A renal function test as a meningococcemia is a multi or involves multi organ.
Mhm.
So renal function electrolytes, uh, liver function test,
Okay.
and chest X-ray also, because the child is tachypneic,
Okay.
and blood culture.
Mhm.
Mhm.
Okay, how you are going to treat this child?
మా కరాచీ పాకిస్తాన్ డిస్కస్ చేసుకుంటే వాటి క్లినికల్ స్టేషన్స్ మార్చి
You just
కేసు
kindly,
ప్రెసెంట్ చేయాలి ఇప్పుడు ఇంకా రాలేదు నెల పట్టచ్చు 6 months
Okay, Dr. Kaya, can you unmute yourself? I'm sorry, I just muted by mistake.
Yes.
Okay.
I will involve my consultant and do airway breathing and circulation, maintain IV line, and check for
Mhm.
hydration. According to that, I will give fluids and start antibiotics.
Okay.
We'll start from penicillin
Okay.
until the blood culture report is available.
Okay.
And monitoring is very important.
Right.
This
Okay.
symptomatic
So,
management.
for example, there is another child who is the brother of this patient. He was playing with him few hours back before he got sick. So, how you are going to manage him?
Um, I will give him antibiotics, ciprofloxacin,
Okay, very good.
and ciprofloxacin. Yes, if the child is stable,
Okay,
and rifampicin can be given.
okay, very good. Okay, so your time is up. So just give me 1 minute. Let's read this topic, okay, from the guidelines.
Okay.
Do your study that whenever you see any topic, better to read it from guidelines. These guidelines are very important because it will save you when you're doing your video station, when you're doing your history station, especially the discussion portion, and it can also help you in your clinical stations. So, what we have done, I just give you my practical experience that read it uh, by yourself for the first time. Quick, just give it a quick read. They are not too much, they're just few. See, 335 pages, I think. Once you read it by yourself, then read it with your friend. Some he should be reading, some you should be reading, discuss it. And then just before your exam, read it by yourself once again. Only the important one, not all. And the other thing is that whenever you are discussing any video station, so just go there and just quickly refresh. A time will come when you will be reading, for example, you read meningococcemia 3-4 times before. So when you're reading it for the fifth time, so it will take just hardly few seconds from you, okay? Because you will know that what to read and what not to read. So that is important. Once you develop that thing, that you know that what to read and what not to read, then it means that you are there because your eye has developed. Okay, so see, these are the symptoms which you see in meningococcemia: fever, vomiting, lethargy, irritable, uh, sick looking, headache, muscle pain, and X. Then there are few less common symptoms like chills, diarrhea, abdominal dysentery. It can be anything because usually it's a septicemia. Okay, now it can be a septicemia and it can be only a meningitis. Okay, but usually if it is a septicemia, so remember these things that they can present with shock, hypotension. So this is very important. Okay, so I'm sorry, I just have to admit. So that's why the blood pressure cuff was attached to this patient. Remember, like these videos which I was showing, this is a Royal College videos. So that's why I was very much reluctant making these videos, but anyhow you guys compelled me, so I just made recording. So what you can see is that they give you a hint, okay, and that hint is important. You have to pick that hint. A sharp candidate will pick the hint, and then the rest of the things will be an easy going. Okay, so what happens if you do not pick the hint, then you will be roaming here and there, but you will not hit the exact point. Okay, like for example, the candidate I asked, she said meningococcemia, but she said that on the second, and she talked about measles. So why in measles there should be this BP cuff attached. Okay, so that's how when you give this type of an answer, then the examiner talk to you, ask why you are saying measles. Have you seen his eyes? Have you seen any evidence of conjunctivitis? Have you heard any cough from this patient? So that's why you need to see enough evidence. Just kindly watch your mics, please. Just I don't know, Dr. Obed, please. Okay, so what you need to do is that you need to see enough evidence to support what you're saying. That is very, very important. Okay, so here, like, I don't say that measles, if you say that should be absolutely wrong, it will not be a wrong one, but it will not be an answer which will get you full marks. And maybe the examiner has a key in which this was not the case, this was not the answer. Okay, so that's why it is very important that you talk properly. Okay. Okay, when you have a particular rash, and there is there is one other question which they ask you, that what two question in the history you will ask. Okay, so Dr. Kaya, what two question in the history you will ask for this patient?
Family history, any contact history.
Fever is very important, and any contact with such type of a rash patient. Yeah. Okay, so what you can do is that you do these investigation. Okay, and these are the CBC, the CRP, the coagulation screen, the blood culture, as you said, the PCR for this is very important. Okay, this PCR for and meningitis. Now see, the examiner would have a key, and these things will be there in the key. If you say anything outside these things, so he will not accept. Why? Because they're not in the guidelines. So you just have to remember these things, that the CBC, the CRP, the coagulation scheme, the blood culture. So you talked everything about that, but you did not say PCR for and meningitis. And then the blood glucose and the blood gases. Blood glucose is very important. Okay, if you don't say the blood glucose, I think that will not give you full marks. And the blood gas is also very important. Okay, okay, and then if CRP is raised and WBC count raised or low normal, treat with ceftriaxone. Okay, you said antibiotics, but you did not tell which antibiotics. So here clearly IV ceftriaxone is written, so you have to say IV ceftriaxone at least. Okay, that is very important. Okay, and the other antibiotics are also there. I mean, you can take their name like benzyl penicillin or blah blah blah, so many things, but in guidelines it is ceftriaxone, so you have to talk about ceftriaxone. You will just say admit ABC, inform my consultant. Somebody should tell me, meningococcemia is a notifiable disease or not?
Notifiable.
Yes, so there is a list in this red book. You just go to the index and see what are the notifiable diseases. Okay, so just go there and read what are the notifiable diseases. So you will find it over there. So once it is a notifiable disease, so you have to say when you're explaining the management that I'll notify it to the concerned authorities. Okay, so these are, I mean, these are simple things, but you just forget something from it. Okay, 287, just go quickly through that as well. Okay, yeah, these are actually a sort of tabulated things which we just saw. Meningococcemia, this one. So they have just shown the severity index for a child who is less than 5 years. That if the behavior, if these things are present in behavior, for example, looks ill to the medical professional, difficult to arouse, there is a high pitch continuous cry, so these are red flags. And if the child is unable to give you social cues, not smiling, reduced activity, so then you can say it's a moderate risk. In respiratory, if the SpO2 is less than 90, grunting, severe tachypnea, then you say that this is a red flag. And if it is less than 91, and if there is moderate tachypnea, then you say this is high risk, moderate risk. And then if the heart rate, if there is a severe tachycardia, then you say that this is high risk, red flag. And if it is moderate tachycardia, then you say it is, what is moderate tachycardia? They have given you the range. And then urine output is very important. Then temperature, extremely important. Why? Because here it's not only the fever, like you said, history of fever, but sometimes these children may have hypothermia. Why? Because they go into shock very quickly, very quickly. Within hours, they go into shock. So that's why I think history of fever is not that much important. Okay, here, especially in younger children of this age. Then others, non-blanching rash. So this slide is very important. Okay, just go through that. This slide, this is extremely important, this one. Okay, so this one is now for a children of meningococcemia for whom the age is more than 5 years. The previous one was less than 5 years, and this one is more than 5 years. I think almost the same, but here the temperature, you see there is nothing about temperature because they don't go quickly into hypothermia because they have more of this brown fat. Okay. Then antibiotics, they have talked about if that is a hypovolumic shock, so just give them fluid and contact PICU, which you rightly said. If it is indicated that there are upper story signs involved, so then you should do the lumbar puncture as well. Okay, if this goes, I mean, if it finishes, so we will join with the same link. Okay, Dr. Pankaj is here, so next case will be with Dr. Pankaj. You should
Dr.
give the
Tahir,
yes.
can I ask you for a favor?
Please.
Can you please describe this video from the beginning to the end for us, and including the how to describe this rash?
Okay, why not? We will do that. We'll do it with Dr. Pankaj. So then you see the lactate level is very important. You see if it is more than 2 after 1 hour, or if especially if it is more than 4, so that is diagnostic. But